Um, okay. This is Mary Collins. This is Mary Collins on Life Hacks Media on Radio X, and I am back with Dr. Akawi, our veterinarian from New York, who is currently in Florida and talking to us about the seriousness of COVID-19. So from there, Dr. Akawi, please tell us, we've been discussing so far what it is, what it actually is, how long it's been around, and what other kind of warning signs we had from previous illnesses like MERS and SARS. And we've discussed now what it does to the body and how it's almost
Yeah.
like a Terminator, like a robot that can go in there and build its own parts in your territory, or like a Trojan horse situation.
Yeah.
So now let's move on to the other part of the section about what
I
you
think
think.
this is a good segue to talk about what are the signs.
Right. Yes. Okay. So speaking of which, you were saying earlier about, talking about the signs that you in your own veterinary practice, I mean, what did you think when someone started coughing? Did you immediately think, uh-oh, or did you think, nah, couldn't happen to us?
Well,
Like
remember, this was the beginning of March, and at the time, literally, there was not as much information, first of all, and facts. I mean, we didn't know. Now I can tell now. Hindsight is 2020. Like cough is number one sign. Fever is number one sign. Shortness of breath. I mean, now you can look at a case and say, this is potentially corona, because some of those signs overlap with the flu, with the rhinitis and allergy season and the spring and all that stuff.
right.
You know,
So this is it. I've had a lot of people say that they think they had it back in December. And I'm like, oh, did I have it back in December? Because I had like conjunctivitis, and I didn't have a cough, but I had like a tight chest, and immediately started to take my own home remedies for that. But I did think it was a tough one. And so I think a lot of people are like, ooh, runny nose, and not sure if they were feverish. And there are two strains, right? There's a more severe and a less severe one. So
no. But also remember, the reason we went through all this effort to explain it to people, how it gets, and to really recite the clinical signs based on where the virus is. So it attaches, it's making the cells, it's making destruction to alveoli. And, we're talking about a week or 10 days later, a week, 7 days. So what are you going to do when those alveoli start to collapse? You're going to cough. You're going to try to cough them. And in this balloon of pneumocytes, now we have a destruction of the mucosal cells. So you have mucosal cells, you have dead macrophages, you have dead neutrophil, you have some proteins, enzymes. That is like, if you look at that on an X-rays, that's a consolidation, and people just can't. The first signs will be is trying to cough, and that cough is productive because you have a lot of junk in there, sputum. And if you remember when we were describing the interleukin-6 going to the brain and resetting the temperature center, so fever is another sign. So again, a lot of times people will have the fever and not have all the other signs. If they have a strong immune system and the body is working through it, and it's not going through the destruction that we saw with the scenario. Obviously, this destruction scenario will be more prevalent with an older person. Anybody over 60, I would say, will be more at risk than, of course, everybody can get it. But if you are 60, I mean, this is why we're seeing those signs in Italy. The average age of the person hospitalized and almost potentially faces death is 81. And those guys probably have type 2 diabetes. They have a lot of them are smokers. I mean, we can't discount that. A lot of people smoke. You already have the pneumocytes that are vulnerable, cancer, survival, other diseases. But let's focus on the signs. So we have the cough, we have the temperature. And since we destroyed the blood vessels around those alveoli and we have permeability and fluid going also inside the lungs, then you get shortness of breath because there's low oxygen exchange rate. So if you go to a hospital and they do SpO2, which basically the amount of oxygen in your blood, and if it's 89 or 85, it should be 100.
Okay.
Then you are losing oxygen somewhere. That's corona. You're not going to see that with bronchitis. You're not going to see that with the flu. So
Right.
yeah, so those are, and if they take your blood pressure and it's really low,
Oh, okay. That's another sign.
another really disturbing sign. That means you are really in getting into the bad shock and sepsis and organ failure thing. So those would be the signs that I would look at. And you're not going to see that with the flu. You're not going to see. Well, I don't want to say you're not going to because, but typically sneezing and no runny nose and conjunctivitis are not the hallmark of the coronavirus.
Okay.
They go deep inside of the lungs, and that's
So
why.
for at home, to start off with, at home, because an oxygen test isn't on hand, but one of the first things, if you're caring for someone or you're worried about yourself, know how to do a check blood pressure.
Exactly, but I can give you an oxygen test that you can do at home. It's a hack test.
Yes, please give us a hacks.
Yeah, okay. So typically, in a normal, healthy individual, if you take a deep breath, okay, down to your thorax chakra, and hold it for 7 seconds, you should be able to do that easily.
Okay.
If you have low SpO2, you can do that.
Okay. So that's the first 7 seconds. If you can't hold it for your breath for 7 seconds, a deep breath, this is when you need to go and check your temperature at this point, maybe, or?
I would, and that's another important thing. You don't want to go to the ER right away because if you don't have it,
you can catch it.
You can catch it over there. Those guys need to be, available for other people. So really, leave your healthcare. If you can telemedicine with them or ask them questions like you do, sometimes you just send a message or text, then that's okay. But don't call and make an appointment and
because you have a runny nose.
Exactly, or So you really have to have all those signs, at least 3 of those signs. I mean, if you have a fever and you're coughing, productive cough, and you have shortness of breath, I mean, those are huge 3 signs.
Is there a chance that you might not have a fever? Because I had dengue fever as a child, and I don't seem to get a fever. I get chills, like I'll sweat. But I won't actually get a high temperature.
So what is a fever? Let's talk about that. I mean,
that's exactly. This is another confusion. What is a fever?
Yeah, a fever by definition for healthcare provider in human is 100.4 or higher.
Okay.
So if you're running 98.6, that's not a fever.
Okay.
If you're running 9.9, that's not a fever by definition. I mean, when you're really ill with this virus, you can reach 102 and 103 too, which really devastating at that point. So
this is something else. So I've heard that you're supposed to, that if you let your body have a fever, it helps fight it, but maybe not in this case. Maybe in the case of flu, but not. I mean, how does that work? How does that balance out? Because some people are saying don't take things that lower your fever, and others are saying let the fever. Don't let a fever get too high because you can have brain damage. What is the situation with fevers?
That and the misconception, brain damage is with 105, 106 fever. And, and with this, if you have 102, 103, if you go back to the scenario we were describing, that's going to dry out the fluid of the body and complicate things, making you more dehydrated and making you less able to fight. So But then we have reports coming out of France and Italy and Europe. People were taking ibuprofen, and those reports turned out to be true. Ibuprofen was not recommended to lower the fever, and because it was causing more side effects. So Tylenol would be the one to use.
Okay. Is it
If
a good old-fashioned like tepid water bath of any use whatsoever? Or
Absolutely, yeah. Water bath, ice,
kettle tea?
yeah, a simple fluid,
Right.
bone broth. I hate to
Yeah.
go back
Yeah.
to bone broth, but anything,
Good.
obviously, you have to drink it cool, not hot.
Okay. I was gonna say, do you drink it hot or do you drink it cool? But I guess no,
Drink
because it
it cool,
raises
yeah,
temperature.
because you're doing two things. You're trying to lower the fever, but you're replenishing the electrolytes so you don't get dehydrated, which will make the fever worse in a dehydrated situation. So yes, in the hospital they give you Tylenol when you first go in because obviously they start fluid too, but you have to be very careful with fluid because we already said that the person get pulmonary edema. They get fluid in their lungs. So one have to be careful as a healthcare provider how much fluid to give to those people. You can over, yeah,
Interesting. So what about a nebulizer? Because I have to admit, I went out and bought a nebulizer because I was like, I'm going to treat this with some like eucalyptus and a nebulizer to kind of clean the system. But does that mean that moisture in the lungs is like the worst thing that you can do, or does it depend on what it consists of?
it depends on what it consists of. Nebulizing is okay. We're talking about giving intravenous fluid and
Right.
overloading their ability to pee it out. Now,
Oh, okay.
you're almost having a compromised kidneys
Wow, okay.
or for the cells to absorb that. So it's going to
Mhm.
go to a third space. If you give too much fluid to a sick patient and they can't pee it off, breathe it out, or sweat it out, it has to go to a third space, which means the abdomen or the thorax. And those guys already have compromised thorax. The last thing they need is more fluid coming from exogenous, from intravenous catheter, overwhelming their lungs. They can't even function. So you really, my point is, when they give it, they have to be really very careful. Give maybe half the maintenance level of the fluid.
Mhm. Mhm.
And so, those are the signs that people present with. But there's a lot of things we can do at home before we talk about the actual therapeutic
Mhm.
that it has been used so far. And what do we have evidence of research to prove or disprove? Let's talk about alternative because me and you have the same
Yes, we
interest.
like our alternative.
Yeah,
Okay, so we'll leave that at part three of
for
our
treatment.
yes of
Yeah.
what to look for. So people out there, those are your top hacks. Remember, yes, it's flu season, and it's actually now pollen is in the air because it's spring. So you might be coughing and have runny eyes and itchy eyes, and maybe a bit chesty because it is that time of the year as well. However, when you're talking about COVID, before you rush down and actually get infected or create more of a burden on the healthcare system that's already overwhelmed currently with actually sick COVID patients, check to see if you have got a constant dry cough, which is, different than the chesty phlegm cough. And if you have a fever over 102,
100.4.
okay.
Anything above 100.4 is considered fever.
Okay, so anything over 100.4 and anything, and definitely serious if it goes over 103, because you were talking about possibly
Absolutely.
their brain damage after that. And if you do have a fever, get someone or call for help. Don't go out if you can help it. Find a way to cool the body down and find a way to check your blood pressure and do the breathing test. Hold your breath for at least 7 seconds. See if you can hold your breath. It's a sign. It shows how much oxygen level you have in your system, and that is also a good indicator if you're in trouble. So thank you very much, Dr. Akawi. It's been a pleasure.
You're welcome.
Pause.